Hi, it's Paul here, Chief Executive, and I'm just going to give you a brief update about the discussions we had at our board meeting yesterday. Different to a usual board meeting, actually this session was what we called a board seminar, which actually means the board, including the non-executives and the exec directors, have time together to talk about where the organisation's at the moment this year, but also to think about some of the things that are going on within the local NHS system that will have ultimately an impact on the Oval Hospital. We started the day talking about some of the opportunities and challenges facing the Trust this year. Obviously, as you know, there's a lot of pressure around increasing demand in the hospital and activity coming through the hospital. There's a lot of work going on, I know, to look at how we can improve flow of patients, reduce our delayed transfers, and all of that is critically important in terms of how we manage our financial position this year. So we talked a lot about some of the pressures financially that we have as an organisation and the steps that we're taking to deal with them. There's some really good ideas of things that are going on across the hospital to try and reduce our costs, which is obviously really important at this time. But we also want to make sure that we're continuing to provide good quality care, and there are also lots of initiatives that are happening around the organisation to improve the way we care for patients. So we spent a lot of time as a board talking about that in the first part of the morning. Second part of the morning we talked about some of the things that we're doing that are influencing within the hospital, but also outside with our colleagues in primary care. And many of you will know about our Symphony project, which is looking at how we can integrate care for complex patients between hospital and GP services. So we spent a bit of time talking about that work and the impact it's having already on some of our complex patients, and importantly how it's a key part of our strategy as a hospital moving forward. We also talked a bit about our new organisation called Symphony Healthcare Services, which some of you may know was established earlier this year as a subsidiary company of the hospital, and it's actually a company now that runs 3 GP surgeries within the local area of South Somerset. We talked a lot about what that meant for us as an organisation, and also how Symphony Healthcare is going to be developing and expanding its remit over the coming 12 months, with a large number of other GP practices looking to join that organisation over the coming few months. And finally, in the afternoon, we talked about what's going on in the wider health and social care economy across Somerset. As part of our work to try and work in a more joined-up way, not just locally within South Somerset, but across the county, we're part of what's called a Sustainability and Transformation Plan, STP, which are plans that are being developed across the country to see how the NHS and social care services could be made more sustainable into the future, both financially and clinically. And as part of that process, it's really critically important that we work together with our colleagues at Musgrove Park Hospital in Taunton, colleagues in Somerset Partnership Trust who provide mental health and community services, the council who provide adult social care, and our local GP colleagues. A lot of the work of the STP in Somerset is based around some of the things that we've been doing for a couple of years already as part of our Symphony programme here, but there are also lots of opportunities to further improve the way we work together, redesign the way care is delivered, make sure we're providing better quality and improved care for patients, but also recognising that's being done against an environment where the financial resources available to us are very constrained, so we've got to come up with some very creative solutions to how we do that. So we'll be doing some further briefings around the STP for staff within the organisation as we go forward. I think overall the board felt that it was a really good day. There was a lot of debate and discussion, and a recognition there is a lot going on both internally within the Oval Hospital and across the wider NHS locally. But the really important thing is that every day we carry on focusing on delivering the best quality care that we can provide to our patients, and make sure that everything we do, both locally and across the county, is always focused on that as its primary purpose, and I think that's a really important thing to keep in mind. The final thing we did at the board meeting was start to have a conversation as a board about how, some of the resources that have been made available to us through a legacy. Some of you may know that recently we've been very, very fortunate that we've been left a very large legacy of £2.5 million by an elderly person who died and left all of her estate to the hospital. Obviously this is a fantastic opportunity for us to think about how we could use that large sum of money to improve the quality of the environment within YDH. And we started having a conversation yesterday as a board about some of the schemes that we might want to spend that money on. So it's very early days yet at the moment, but I'm sure we'll be communicating out more widely within the organisation over the coming months about how we're planning to use some of that resource. So all in all, a really good day, a busy day, and hopefully a day that gave the board a real opportunity to think about some of our key strategies for the rest of the year going forward. Hopefully that's given you a good overview of our board this month, and we'll look forward to giving you a further update next month.